want to get a feel of the movement of the humeral head on the glenoid. The two directions that we don't necessarily in a stiff person see their shoulders sitting anteriorly. You may assess that and I'll show you in a different test how you will do that. But in this position we were going to look at an anterior to posterior glide of the humeral head on the glenoid. And all we're doing is getting an appreciation, comparing right to left, does it feel tight? So you need to stabilise, so you've got the scapula already stabilised against the bed, so that's okay. Now you're just going to hold over the top of the acromion to stabilise the scapula as you move. My hand is going to be around the humeral head and I'm going to do A, P. We're going to start in neutral. If you can come just a little bit to me, that's it. So I'm just keeping the arm sort of tucked in to stop it falling off the bed and also to keep you nice and relaxed. Stabilising here. With this, try not to be too bony on your push, and when you do mobilisation around the shoulder, if you sort of bunch the deltoid muscle up a little bit, it creates a little bit more cushion so it's a bit more comfortable. So just creating that cushion, so now that is on the top of the humeral head, there's the acromion and I'm stabilising here. And what I'm trying to do is A, P, in that, sorry, PA, thank you, in that direction. Now also remembering the shape of the glenoid. So if you push straight down, if you've got that sitting there and you push straight down, you're potentially hitting into the back of the glenoid. So when I push down A, P, I'm actually doing a little bit of a scoop movement as well. So stabilise A, P, but with a little bit of a lateral, yeah, a little bit of a lateral bias there. Again, get a feel for the joint, and then if you are dealing with stiffness, you need to go to end range of movement, so get that real feeling of it stopping through there. Then I'm going to repeat that position, repeat that direction, but in an abducted position. And this might be then out towards where they start to feel stiff in their shoulder. Again, I'm going to just bunch up the
Yep.
Thank you. I'm going to say weird words and then you're going to all put the right one in for me, okay? So stabilising at the distal humerus, bunch up the deltoid. My hand is on the anterior humeral head. The bed is doing the stabilising of the scapula here. So the proximal side of the joint is stabilised. Bunch up, feel the pressure, and then again it's a little bit of a lateral bias with my pressure, taking it to end range and feeling that end range of movement through there. Reproduction of pain, does it feel uncomfortable? Does it feel stiff compared to the other side? The other direction that we may want to get a bit of a feel for is a caudad direction. And again, thinking as you're coming up into those higher ranges, think about those slides that I showed you with the frozen shoulder and that loss of that axillary fold of the inferior capsule. Does it feel stiff and restricted in that direction? So acromion off onto the humeral head. This one counterbalancing with my hand on the elbow, so that when I move, I'm not doing that, but I'm trying to move the whole arm from the humeral head to the elbow as one piece. Take up the slack and then down. Now what you don't want is a large traction force at the shoulder. So if you're starting to get a stretch through here, you're pushing too hard. Just get your feel so that you're taking up the slack and then a little bit of an oscillation at range here. But I shouldn't be seeing this sort of movement as I do it. Okay, so light, medium, firm, but if you're looking at stiffness, we have to go to that end range, that grade 3 or 4 movement to get a feel for it. Okay?
So when pushing that way?
I'm pushing caudad. This one I'm just stabilising. So I'm pushing caudad.
So not along the joint line?
Along the joint line, again probably a little tiny bit of a lateral bias towards that movement. But I'm not pushing like that. The line of move, the pressure, the direction I'm pushing is directly along the line of my forearm. So that's the direction I'm pushing. There. Okay? Now all of these we can adapt into treatment techniques. We can also use them as modification procedures to see if it makes a difference. Can I get you to practice those 3 techniques? And we'll move on to the next one.